Georgie and Richard, it's so wonderful to see you. I can't believe that this is actually happening. Thank you for bringing me along for this incredible ride. So I was going to ask both of you, why NHS Ocean? What does this mean to you?
Yeah, hi, Laura. And, thanks for everything you've done over the last year. This has been incredible. I mean, for me, I'd always been an ocean enthusiast ever since I was a child. I often say that, marine biology and medicine were side by side on the university application form, and I ticked the wrong box. But medicine's a great career. I progressed through. And the one thing that I kind of noticed as I progressed through medicine was I was always looking internally towards the hospital. I'm a critical care physician. I'm always very much kind of looking within the hospital for solutions. I started reading about things like climate change, however, quite some time ago, but I realized that most of what I was reading was land and atmosphere focused. We were talking about trees and tech. Oceans were just not really getting mentioned a lot, but I knew oceans were amazing. As you've said, 70% of the Earth's surface contain most of our water, 99% of the living space, 80% of all living organisms are in our oceans. But over the last 70 years, they've been put under incredible strain due to the growth in human population, industrialization, and the need to move vast quantities of goods around the planet. I found out that about 80% of the goods I was bringing in, or we were bringing in so that I could provide patient care on critical care, were being delivered on huge container ships. I knew 62% of our NHS carbon output was related to the supply chain, and shipping is responsible for 1 billion tons of CO2 a year. That's 2.5 times more than the UK produces every year. The more stuff, or the more healthcare I was providing, the more stuff I needed, the more we had to bring in on ships, the more we damaged the oceans and the atmosphere, the more that affected human health, the more healthcare I had to provide, and so on. We were on a very kind of dangerous, positive feedback loop. And I just felt we needed to get to grips with this and break this loop. I was really inspired at this time by groups like the Centre for Sustainable Healthcare, the NHS Forest, Sustainable Development Unit, now the Greener NHS, Healthcare Without Harm. So I started talking about oceans everywhere. And I talked about it at a regional Northeast ICS meeting. And there I made my first connection, and that was Georgie.
Yeah, that is how we met, and thanks again to Laura and Richard for today, and to everyone who's joined us. So I'm a GP, and like Richard, I've been involved in healthcare sustainability as well for the last few years, and I've lived and worked and volunteered and enjoyed many different coastlines throughout my career. But for the last 15, I've been working in the northeast of England, where we have this amazing coast, which stretches from the border of Scotland right down to Yorkshire. And within healthcare now and healthcare sustainability, there's this real awareness that the climate and nature emergency are a health emergency, and that human health and that of the natural systems are codependent. And in my spare time, though, I was spending as much time as I could in the North Sea. So I often wondered whether looking at this through an ocean lens could do a few things. Firstly, optimise and strengthen the work that was being done already, but also to make sure that oceans weren't left behind, and that, of course, in healthcare, that we had our own house in order. And there's a real energy and drive in the Northeast here in healthcare sustainability. And as Richard said, it was here that I heard the first time another clinician mentioning ocean. So we met. And what was really interesting was reflecting on ocean health from two completely different clinical areas and contexts. So I was coming from the community, prevention, population health, primary care, and Richard from that point of secondary care, of illness and of ICU. But as we got talking, we could find many, many links. And so we started to talk to as many different voices and organisations as we could, whilst being really respectful of how much work's being done already in these fields, or lakes, I suppose, to see what links we could find or gaps that might need to be filled by healthcare. And actually, it turned out that there were a lot. And again, that like with climate, that healthcare could potentially be part of the problem, but also part of the solution. So that was when we met you, Laura.
Thank you. And when you started to inspire me, I guess I would ask, since that time, are there things that you can talk about that have been real highlights for each of you in terms of your journey around NHS Ocean? Richard?
Well, I mean, for me, it's the network. For me, it's the fact that it's just a series of highlights. There's not really been any lows, because from the day that Georgie and I met, we then obviously reached out to you, Laura, and we also reached out concurrently to individuals around the country and around the globe. And we had this kind of nascent idea. We had this concept that we just didn't quite know how to progress it. So we made the link between human healthcare, our healthcare suppliers, industry, marine health, environmental health, all these areas. And so we reached out to Plymouth Marine Laboratories, we reached out to Lloyd's Register, we reached out to shipbuilders. I mean, what an odd kind of conversation that was to start having. But we just reached out to everybody. And what we found was, everyone that we reached out to and explained this to, because we all care about, or most of us care about our health. We care about the health of ourselves and our loved ones. So we could reframe the conversations that they were perhaps having about decarbonisation and reducing pollution, but reframe it through the lens of healthcare. And for me, having that kind of penny drop was just incredible, because suddenly everyone was listening. Suddenly the speaker invites were coming, and they just keep coming, and people are saying, how can we work with you? And we have this tsunami of volunteers now who just really want to, they now understand how critical it is for us to have healthy oceans, for the planet, and for humans to be healthy.
Yeah, I think I agree with Richard that with all of that, and yeah, absolutely, the networks and the people that we've spoken to. And I think it's been a very difficult time in healthcare for the last couple of years, certainly 18 months. And it's just been such a highlight to understand how many amazing organisations and individuals are working. So to reach out and have this wealth of fantastic connections has been amazing. I'd also say one of the highlights has been the learning. Really reinvigorated that absolute pleasure of learning mid-career, which has been fantastic. And I think moving forward as well, sometimes we look at health and we look at maybe climate and nature sort of separately in their own silos. But when you look through an ocean lens, you have to see that everything is connected. It can't be separated, and you can't look at one without the other at any point. And I think that for me has absolutely been a real highlight and a sort of clarity as well.
That's brilliant. I guess my other question for you now is, what are you hoping might come out of this NHS launch that we're doing right now?
Wow, well, we know we're the new kids on the block, Laura. We've joined something that's been, kind of moving forwards, driven by individuals like yourself. We understand through our networking just what an incredibly huge topic we've picked. We haven't picked the quick and easy solution here. What we've picked is something that has a potential for huge global impact, involving global industries and global health services, but then with a huge global benefit for the health and well-being of humans all around the world. I mean, we can't, get away from the fact that, the healthcare we deliver in one country can impact upon others. So we need help. This is a shout out. This is the start. This is where we go, well, look, we're just two random clinicians who happen to get together in a regional meeting. We have this idea. We are fortunate that we had this idea when Greener NHS just exploded. We had the Sustainable Development Unit, it turned into Greener NHS. And suddenly, we've got, Greener, the STU has turned into this big Greener NHS team with these amazing ambitions. So, okay, so we have an amazing ambition too. We're obviously hitting the ground at the right time. We just need help to make this a reality. We recognize we're not the experts, and we know that there's going to be a lot of people listening now who know an awful lot more than us and who can help us.
Yeah, and I think when we thought about today as well, we were hoping to inspire and engage others in healthcare and otherwise in our decisions and actions, and reminder that the ocean obviously starts in land as well, and in healthcare it starts in our drains and our loos and our sinks. But also we've reached out, as Richard said, to so many different individuals and organisations to get to this point, and we know we need as many different others as well. And that also, like in all aspects of sustainability, that we might need to work in very different ways. And we need to learn about that as well. So if we come away today with some actions and some ideas and some different connections and links, so that all of us can start to think ocean a bit more. That would be fantastic.